The first step in assessing a patient with a potential coronavirus illness is to measure their vital signs. For patients living in remote communities, this can lead to long travel times and expose them to unnecessary risks. For example, the distance from a Harkle medical practice to Kilchone is only 22 miles, but it takes 50 minutes to drive there by car. We propose to have basic automated medical equipment in these remote communities, which will help save time, money, and lives. This will lead to more efficient use of doctors' time, increasing the number of patients they can see per day, and reducing delays in urgent medical care. Our suggestion is to place the doctor's bag in key locations in the community where individuals can self-measure rather than travel to their local GP. The doctor's bag would consist of a pulse oximeter, thermometer, and blood pressure monitor. Observations are quick and simple and can be performed by the patient, friend, or family member. The bag would be secured in a locked device similarly to how the community AEDs are kept. Doctors would issue patients with a one-time code which would be used to unlock the bag and to tie the recorded data to the patient. Instructions are given to the user through a user interface with visual and localized verbal commands. Paper copies can also be provided. At the end of use, the unit is then decontaminated by the user and the recorded data is automatically sent to the doctor. Units are financed by community and local medical practice buy-ins. Responsibility lies with both parties, as without both agreeing, the project cannot function. To first test the ergonomics, an initial usability study of 50 people would be undertaken in the local community. A local area trial would then be carried out, with up to 5 units being placed in community halls. Finally, a district-wide trial would then be carried out before widespread adoption. Backing from local governments could ensure a lifeline for these remote communities. The benefits of local medical equipment are still prevalent for a post-coronavirus society. The doctor's bag can still be used to detect sepsis and other medical emergencies.